Now the next topic is shoulder dislocation. So in shoulder dislocation, what is dislocation? Dislocation is if two bones is forming the joint and one joint is dislocated, uh, one bone is dislocated anterior or posteriorly, it leads to dislocation of joint. So in shoulder dislocation, the humerus, mostly in most of the cases it goes anterior, and in some cases it goes posterior. There are three types of dislocation: anterior, posterior and inferior. The most common is anterior, and in most common anterior is subcoracoid. Okay, so the patient will present with arm is in abduction and external rotation. So जब आप बॉल फेंकते हैं, ऐसे बॉल फेंकते हैं, तो आर्म, तो there could be a chances of shoulder dislocation. Patient will come like this. Arm will be in abduction and external rotation. तो patient ऐसे लेके आएगा आपको हाथ. Okay, so that is anterior shoulder dislocation. Okay, so the nerve most commonly injured. So because the axillary nerve is encircling at the surgical neck of humerus, so most likely the nerve injured is obviously axillary nerve. Okay, now the various tests used: Hamilton ruler test, ruler touching the acromion and lateral epicondyle. So it will help you to diagnose whether it is an intershoulder dislocation or not, because shoulder is dislocated. So this test will help you. Okay, Dugas test. So because the shoulder is dislocated, so you cannot touch the opposite shoulder. So difficulty in touching the opposite shoulder. Calvé test. Girth is more and affected. So Calvé girth is more. Okay. Now there are various reduction maneuvers. So that is modified Kocher. So first you have to give traction, then external rotation, then adduction, then medial rotation. Okay. So this is the method to reduce the dislocated shoulder, because now the patient came to you in casualty with anterior shoulder dislocation. Now you have to reduce that. Obviously you have to reduce that joint. So what you have to do? You have to do the modified Kocher maneuver, that is traction, external rotation, adduction and medial rotation. Other is Stimson technique and Hippocrates. So in Stimson, patient is lying prone and you will hang the arm. Okay, that is Stimson. Hippocrates is you will place the foot in the axilla and that is acted as a fulcrum. Okay, पैर ऐसे आप लगा दोगे arm उसके axilla में, and then you will pull the arm. So this is the Hippocrates maneuver. Okay, now the complication. So because this is humerus, this is shoulder joint, this is humerus. Okay, so you can see if this shoulder is dislocated, it is labrum is here, so it will rub the labrum if the shoulder is dislocated anteriorly. Okay, this is scapula. So if the shoulder is dislocated even once, the labrum will be get torn. So labrum got torn. So that is known in antero-inferior part, that is known as Bankart lesion. Okay, and the postero-superior part, it leads to, in antero-inferior it is Bankart lesion, and Hill-Sachs is posterolateral. So it is posterolateral. Hill-Sachs lesion is posterolateral. Okay. So how will you remember the intershoulder dislocation? There we have mnemonic, that is Abir head Cabot Cosi. Abir head Cabot Cosi. AB is for abduction, E is for external rotation, Hamilton rule test, Dugas test, Calvé test, Bryant test, and axillary nerve most common nerve injured, Kocher's maneuver, Stimson maneuver, and Hippocrates maneuver. So these all are the test, nerve and everything is covered in just one line. Okay. Now we have already explained why it is the most common recurrent shoulder dislocation, is why most common complication of shoulder dislocation. Why? Because shoulder is dislocated once, it will torn the labrum. If it torn the labrum, it will again likely to get dislocated. Okay. Now the posterior shoulder dislocation. So you can see this is posterior shoulder dislocation. You will find the light bulb sign. Okay. Inferior shoulder dislocation is luxia erectica. Okay. So this is, you have to understand, you have to learn this anterior shoulder dislocation. Okay. If you like these type of notes, if you want to see entire video of upper limb trauma, then you can download my app, Dr. Priyesh Nayak app, from App Store or Play Store, and you can watch my free video. Okay. Thank you.